My name is Kelly, and I've lost 112 pounds. I was very overweight, unhealthy. I had 2 kids, and we were actually trying to have a kid, and the weight was kind of in the way. So in 2009, I decided to have the gastric banding done. But I started having issues where every time I ate, I was throwing up, and I was always in pain anytime I ate. And then that's when I met with Dr. Gerard, was in November of 2023.
Kelly first came to me. She had previously had a lap band placed to help with weight loss. She felt that her weight loss goals had not been met, and she had all these issues with reflux and nausea. So after a discussion, we talked about removing it and just going ahead and converting her to a gastric bypass, which could help her lose additional weight and also address some of those reflux and nausea issues.
I started noticing the weight loss a month after I had my surgery and before I started going to the gym. Before I had my gastric banding, I'd weighed 321 pounds, and before I had my gastric bypass, I weighed 284 pounds, and now I'm at 177.
She did great. Her weight loss overall was as expected, maybe a little bit better than what would be expected with a gastric bypass. There's plenty of data that says patients don't typically do as well from a weight loss standpoint when it's their second procedure. And she broke that rule. So, she ignored that conversation entirely and had great success from it.
I didn't really have like a big weight loss goal in mind, but after talking to Mr. Greg and everybody, I was like, you know what? I think I'd really like to be back to the weight I was when I graduated from high school, which is 165 pounds. And now I'm 12 pounds away from reaching that goal. So I'm excited about that.
Kelly came in with high expectations and had, I think, the willpower to be able to execute what we thought would be those steps necessary to have long-term success, which she's done.
Since my bypass, I have changed the way I eat, the way I look at food, and now I've learned how important exercise is no matter what. I get up every morning. I'm at the gym at 4 o'clock in the morning. Yes, 4 o'clock in the morning. I go to the gym, I come, I work out, and then I go home and get ready for the day.
She started out kind of slow, but once she got on like a pace, she was after it. She was here every day. She didn't miss. She got way better. If you can beat me here, you're doing something good.
She gets a level of confidence, not only just from a psychological standpoint, but when you can begin to see the emergence of this healthy transition occur, you think, I don't have to take the sorts of medications that I used to. I'm now able to get out and be more active. I'm pleased with the results that I've been able to achieve.
I applaud Kelly. She was just from day one very, very motivated, not only to feel better, to improve her health, and she did just that. She accomplished all her goals. I actually just saw her a couple of weeks ago, and she was doing great. She's happy.
Since I've lost weight, I actually get to go hiking now, and I'm not out of breath. And I also go to Disney a lot, so walking around Disney has been a lot easier since losing weight as well. It doesn't hurt my feet as much. I have 2 beautiful granddaughters that now I have the energy and strength to play and pick them up and do everything with them. I like the way I feel, and I want to continue to feel that way. I would encourage anybody, if you're looking into getting it done, get it done.